Now, allergens are allergy-generating molecules that specifically cause a response that is associated with the production of histamine. So allergens cause the immune system to produce histamine. And we did talk about histamine as it relates to the inflammatory response. So this is not something that is adaptive or defensive. It is kind of a mistake by the body. The body mistakenly thinks that something that normally would not cause you problems is going to possibly be a problem. So like, for example, pollen produced by plants is not something that's going to take root in your body and actually grow and actually cause disease, but our body treats it that way for some reason. So allergens and allergies are generally referred to as hypersensitivities. Your body is overreacting to something in the environment. So what this histamine does is it causes swelling. So histamine causes swelling. So like, for example, the swelling of your throat can actually be dangerous if it obstructs your airway and your breathing. It also, because it causes swelling, it also can sometimes lead to what is called anaphylactic shock. Anaphylactic shock. And so this is a decrease in blood pressure because so much fluid is now out in the tissues because of the histamine that the blood pressure drops, and it can actually make you pass out. It can make you faint. It can make you go into a coma. So anaphylactic shock is something that is dangerous and potentially life-threatening. So when we talk about this, sometimes there are a few people that have an allergic reaction to vaccinations, right? So one of the dangers of vaccinations is you're putting something foreign into their body and they could have an allergic reaction. So generally, when you have a vaccine, or if you're in the doctor's office getting tested for allergies, they are very, very careful to make sure that you don't have an allergic reaction to whatever it is that they're testing on you. So one way to treat this is through what is called, or the use of an EpiPen. And you might have had one of these, maybe you still have to carry one around. So if you are like really allergic to peanuts, or really allergic to bee stings, or really allergic to shellfish, like dangerously so that you might actually die if you accidentally ingest this, or if you get a bee sting, an EpiPen is a shot of epinephrine. And what this does is it causes vasoconstriction of your blood vessels. So this increases your blood pressure. So this is going to increase blood pressure because of the vasoconstriction of the blood vessels. So this could be potentially life-saving. Another thing that they recommend for parents and also for people that are prone to allergies is that you have Benadryl. So Benadryl is a type of antihistamine that's really powerful, right? So if you notice that for some reason somebody is having an allergic reaction, if you give them a Benadryl, then that could be potentially life-saving. So you want to make sure that you have antihistamines present so that you could use them if necessary.